Hey everyone, welcome to the live stream and happy Saturday. I am glad to be here again on another amazing Saturday to do AMA. Hey, were you guys here last week? How much fun was that? We had our 25,000 subscriber celebration last week and it was fantastic. We gave away all kinds of goodies and prizes. We gave away E&M compendiums. We gave away merch. We gave away some courses. It was just a really good time. So I'm hoping to do that again sometime in the soon. Now, I was just out yesterday soaking up some sun. Since I'm here with you guys every Saturday, I thought to myself, well, why am I working Monday through Friday and Saturday too? So I started taking off on Fridays, being a little bit more kinder to myself. And I hope you guys are being kind to yourselves too. Make sure you say hi in the chat. And now let's get started with the stream. So, hey everyone, hello to Tiffany, hello to Lucy. Great to have you all back today. So today we're just back to our regular, just kind of ask me anything. Hey Sonia, hello Tiffany, hello. Great to have you all here. So I'm going to be taking questions today. Good morning, Hannah. Good morning. Good afternoon, Dawn, and Yvette, and Jingle Bell. Happy to have you all here. So one of the questions that I just saw come through, hi Mira, is from Tiffany. Tiffany's asking about the MIPS reporting codes for ophthalmology. I'm not 100% sure, but I would check cms.qpp.gov. because I believe that's where most of the Quality Payment Program, MIPS, and APM information is available. So that's where I would start with qpp.cms.gov and see if you can find it through the website there. They have so much information, it can be super overwhelming. So it might take a little while to navigate through it. If not, I would do a Google search, maybe QPP MIPS ophthalmology, and see where that will take you. Natasha, congratulations on passing your test. That's awesome. I'm assuming the CPC, but maybe it was the CCSP. Definitely let me know. I'm curious which test you took and which organization. Hey, for Amritha. Hello to Sherida. So great to have you all here. I want to take one question I wanted to address that came through Instagram. So I got a question that came through Instagram, and the question was, can you intern while you're still in school to gain some experience? And yes, it is possible to intern while you are at school and gain some experience. It might be difficult to find some of those locations. I have seen some organizations that have positions maybe within the revenue cycle that are more entry level, and they'll say, we will hire someone with the contingency that they obtain their medical coding certification within a 1-year period or a 2-year period. So there are positions out there. They are sometimes harder to come by, those entry level positions. You know, there's a lot of people after them. So while they are out there, you really have to have your job search tactics in order. A lot of the ones that I've seen are posted directly on the healthcare organization's website. Oftentimes they fill up so quickly that they don't make it external to the feeds on Indeed or on LinkedIn. So it's a matter of really keeping close attention and connecting with your peers as well. So if you are connected with your local chapter, make sure that you befriend the people at those healthcare organizations so that they can get you some information. You do occasionally see things. Oh gosh, I wish I had saved it for you guys. I saw something come through just very recently that there was an organization that was hiring for a handful of apprentice coders, but I think it was on one of those groups where you're actually not supposed to post those, so it probably got taken down pretty quickly afterwards. I'm trying to think of where. I know Change Healthcare hires a lot for just huge amounts of projects and things, so definitely keep an eye out for things like Change Healthcare. They seem to hire a lot. Hello, Janelle. Good to see you back here today. Yeah, so if you're wanting to take a medical coding course, I'm not sure which country you're located in. So within the US, I have an organization that I work through that I could recommend you to. There are organizations just globally. The AAPC has AAPC and AAPC Global. You can check in the video that I have. Hey, thank you for your subscription to the channel. You can just Google around and try and find some if there's local institutions near you or training programs. I try not to personally recommend anything specific just for liability purposes, but just search around your area and see what you can find. Which certification is best to have first, AAPC, AHIMA, or both? So when we're talking about first, I think first, what I say is the default selection. If you're just not sure, go with the AAPC's CPC exam because that is the one that will cast a very wide net. It is very much looked for by employers. So if you're looking for a job in medical coding, there's a lot of positions out there that are looking for the CPC or CPCA. Unless you very, very specifically want to get into inpatient facility coding. And if that's the case, go through AHIMA because they are more known for inpatient facility coding. So coding for the whole patient inpatient stay, all of, the services basically that a patient receives while they're admitted to the hospital. They're admitted to the hospital and the use of all of their nursing staff and the bed and the rooms and the medication. So billing for all of that versus billing for professional services or provider-based services where you are billing for, a surgeon fees or a primary care physician's treatment plan for you for your chronic conditions or an urgent care provider's treatment for you came in because you have an upper respiratory infection or you had, you cut your thumb a little bit while you were cutting an avocado. So those are provider-based services. So if you're ever in doubt, I always say, just go for the CPC exam for the AAPC because that's one of the best default things that you can get because it's just very widely demanded. Sherida is saying, I'm preparing for the CPT exam. Can I make notes or highlight on the printout of the guidelines? So I'm thinking CPC exam. So let me actually show you what it says on the website because I don't want to ever have anyone just take my word for it. I want you to see exactly where this information comes from. But if you're talking about the CPC exam, you are allowed to mark and highlight your books to some extent. Now, there are some things that you can't write in your books, but as far as highlighting, underlining, taking little notes, that's fine. So let's look over here. This is the AAPC's exam FAQs for all their certifications. And if you look here, it says what's allowed in our books. And what it says is basically handwritten notes are acceptable in the coding books if they pertain to daily coding activities. Questions from the study guides, practice exams, etc., are not allowed. Tabs may be inserted, tape, pasted, or glued into the manuals, but you can't supplement information, meaning you can't tape or staple or paste in any extra pages. You can have tabs like these type of tabs or bigger where you're just sticking them in. I used to have some around here that were kind of the more tabby signs or the ones that come with your book. So for example, in the CPT book, on your first flap, there are tabs that come with the book. You can use those as well. But if we're talking about, how you're allowed to take your ICD-10-CM printed guidelines, there's information for that as well. And that is under, let's see, what items will I need to bring to the exam? Is it here? Yes, the ICD-10-CM official guidelines are allowed. Thank you for subscribing, Desirata. So the ICD-10-CM official guidelines are allowed in the exam, so you can print out the guidelines. Highlighting and underlining and brief notations are allowed on the printed sides of the pages. Long passages of information are not permitted on the blank sides of the pages. So if you have it all printed out one-sided, and all your text is on here, you can't take that blank page and just make all kinds of supplemental notes. In most cases, you won't need it because I always say check out your HCPCS book because my HCPCS book here from Optum 360, like this whole section in the back is just blank and says notes. So I could write all kinds of little illustrations. I could write maybe some tables of things that I might not remember. If you will have some certain med terms that you have trouble remembering, there's lots of real estate oftentimes in your HCPCS book to write different types of notes. For the CPC exam, yes. So Emily, you are allowed to have your books tabbed for the CPC exam. I understand it is possibly different for some of AHIMA's exams. I've gotten different answers on that, but what it says in the participation guide for AHIMA is that no handwritten tabs are allowed. So I don't know if that, to me, handmade tabs means that like this tab is not, to me, handmade. This is manufactured, it's included. So I'm thinking they mean for the HEMA exams that you can't make your own tabs. But yeah, for CPC exam, you can have as many tabs as you want. I would not overdo it too much on the tabs because then they kind of defeat the purpose. It doesn't really help speed you up if you're looking through 150 different tabs. And some people will tab maybe certain things on the side and then certain things at the top so they can differentiate. Maybe their alphabetic listings, their A, B, C, D, E, Fs are up here and then other things here, or maybe they just put their notes pages that they tab here. I apologize. That probably messed up the audio because I put my book in front of the microphone. But you can also check out, I have a whole video on tabbing. So if you want to see how you can tab your books for the CPC exam and for your AAPC exams, that is available on the main channel page. I can bring it up to show you guys. So let's see here, your channel. If you go to the channel videos here, it should show up. I think it's one of my playlist items here. So playlists, videos. Actually, let's see if it's on the home page here. The tabbing. Popular upload CPC exam. I know it's definitely on my CPC exam tips page. CPC exam, tabbing book tutorial. Yeah, so I have a whole tutorial there on how to tab your books. Very, very awesome. Definitely check that out. What other questions? Mario's asking, do I have a video on anesthesia coding? Not yet. I will be. I've been doing the reviews and I just finished digestive. What comes after digestive? So I did cardio, I did digestive. Next is urinary. So I have a few more chapters to get through before I get to anesthesia services, but it is on the list, just not for probably a few more weeks. Are there any reasons resources you have for observation coding? It confuses me when it comes from non-admitting specialists billing on each day along with the admitting physician. I don't have anything specific for observation. I would check, though, the Medicare manual because sometimes they do have some information specific for observation coding and what they will and won't allow and how they view billing for observation, especially when it comes to different specialties, seeing who is admitting for observation, what to bill on those subsequent days. So check the Medicare manuals. I think sometimes they do have some helpful information there as well. Hannah, do you have a video on external causes? I have a video for basically every guideline section of ICD-10-CM. I don't have one specifically on external causes, but that's not a bad idea. Kind of like give me a little bit more information on what you're looking for, kind of like when you do use them, when you don't use them, when you add in like the place of or the location type of codes as well. I'm guessing that's kind of what you're talking about, right? Ophthalmology. So let me tell you, Tiffany, I've done a little bit of ophthalmology. I know a chunk of it. I've actually never, I shouldn't admit to this. I've never coded ophthalmology, but I've audited ophthalmology services before. So I know some of the requirements for like their exams, how to audit for the exams that they do, the eye exams. So I could tell you the little bit that I know about ophthalmology, but not a whole lot. Let's see. LW Cruises is asking, I just graduated with my medical coding certificate and taking the test for certification on Tuesday. I found it hard getting a job without experience. Do you have any suggestions for that? Yeah. So I just had this great interview with Kyle Johnston. He is phenomenal. And he sat down with me and we talked about specifically this thing. So again, if you go to the channel page, right here is the interview. It was very, very recent. Here we go. This video here that says get hired on there, and it's got the picture of me and then the keyboard kind of in the background and Kyle. That's the video you want to watch. The other tip that I will give you is if you check on codersdirect.com, you can find a lot of great jobs on codersdirect.com. And you can narrow your search if you're just looking for remote jobs and you're looking for ones that take apprentice coders. So if you can do that, if you want to have a specific location that you're looking for, you can search for jobs that are looking for CPCAs. I used to say just search in Indeed.com for CPCAs, but apparently what happens then is it pulls in the jobs that say in the text of it, please no CPCAs. So I would check even for terms like entry-level coder, or I have a video as well on alternative jobs for medical coders that will still use your coding skills, but they're not technically a coding title. So things like prior authorization, where you're calling in and saying, here's the CPT code. Are you going to pay for this based on the insurance's policies for that patient? And there's some ways that you can do that. So definitely check on left the comment up. Definitely check on the videos that I have available and on codersdirect.com, because the video that I did with Kyle, he gives you all kinds of tips about getting in line with recruiters and how once you are connected with them that they will post jobs and kind of keep you in mind and so forth. Robin, hey, well, welcome to the channel. Great to have you here. Medical billing and coding was suggested to you. You don't know anything about it. Advice where to start. You're at the right place. You are absolutely 110% at the right place. So I have a whole playlist that I built just for specifically people like you. So if you're interested in learning just what is medical billing and coding, what's the difference between billing and coding, what are the salaries, you gotta go. This is great stuff. I have a whole playlist here and it's called You Want to Become a Medical Coder, Start Here. There's lots of information that you have available all for free. It's a whole playlist. It talks about how to become a how to become a coder, difference between billing and coding, introduction, salary, the costs that are associated with it, how to tell if this is right for you. If you want to self-study, there's options there. And then it talks about different job options, the different credentials, if you're looking to work from home. So I have that whole playlist is just for people who are like, I'm just looking into getting into medical billing and coding. The other thing I will mention is if you are looking for a medical billing and coding school, I have an affiliation with onlinedegree.com. So they built basically a quiz specifically for my viewers that are the same questions that I would ask you, like how much you're looking to spend. Are you looking to go completely online? Do you want books included? And they will basically navigate to accredited schools. So you don't have to worry that it's, maybe a organization that hasn't been in place very long, or they might not be back next year, or maybe they don't have good ratings. They only work with proper colleges and universities and that have online programs that will work for people like, people that are in their 40s and looking for a job change, or your kids are grown and you're looking to get back into a career, or you just had a kid and now, they're in preschool and you're trying to get a job or what have you. So they will help you find the right program for you. So they work with great schools and they help navigate you into a good program. And if you use my link there, go.onlinedegree.com/contempo, they have some special bonuses such as possible discounts or books shipped to your door that they are just for my audience. Information about the CDEO certification. So the CDEO, Certified Documentation Expert Outpatient. So this is for outpatient and provider-based services. I hear that the AAPC might now be starting, because I saw this posted on Facebook from someone, a CDEI, which is Certified Documentation Expert Inpatient. So the CDEO is just for outpatient CDI. I haven't taken it myself, so I don't have a ton of insight personally as far as having taken it. I talked to Brian Quee a couple of weeks ago about CDI. And one of the things I said was that, when that certification came out, it was right when people only wanted to hire CDI people who were also RNs or LPNs. And I was telling a lot of people, don't worry too much about it if you don't have your LPN or RN. But now that has really flipped, and there are a lot more organizations willing to hire people that have equivalent clinical knowledge that can work into a CDI capacity. So if we look at the AAPC website, here's what it says about the CDEO exam. It says this is the breakdown of the exam, 150 questions, 5 hours and 40 minutes. That's kind of the standard for these types of exams with the AAPC. It talks about the purpose of CDI, provider communication and compliance. So explain how the OIG can assist in determining the focus of CDI, strategies of communication messages, clinical conditions. So that it looks like there's a huge chunk on here on clinical conditions. Oh, okay. Some of the major ones. Yeah, definitely for sure. Abbreviations, common treatment profiles. So this is not just coding. It's a lot more clinical criteria, clinical diagnoses. 22 questions on diagnosis coding, documentation requirements, payment models. I'm thinking OPPS. Does it say here? Oh, fee-for-service payment models, HCC, and how that can impact, and procedure codings. So 22 questions on procedures, and then also quality measures, even HEDIS, and meaningful use is going to be on that CDEO exam. So way more above and beyond just coding. It looks like a lot more clinical knowledge involved and a lot of payment information as well. Victoria, have you ever worked in appeals and denials or know any good resources to practice for a position in appeals and denials? I worked in appeals and denials briefly. I think I worked in more so the billing AR capacity for about 7 months before transitioning over to coding. And I've worked a little bit here and there in the past, not in 100% that capacity, but I supervised a team of coders and auditors and educators. So when we would get stuff from the billing department on specific denials that was related maybe to coding, I would look at those. But as far as resources to practice, I know there are some billing channels coming up at the current time. Their names escape me, but if you are someone out there watching that does have a billing channel, feel free to comment, because I know some of these people do watch and just keep it on in the background. Janelle is saying, I just finished my E&M block with my online school. They use the 97 guidelines for extended exam exclusively. Will there be questions on the CPC using the 1995, et cetera, or other guidelines? This is how they kind of work it now with the CPC exam. It used to be that when all evaluation and management codes were based off of history and exam and medical decision making, they would give you the level of history, level of exam, and level of medical decision making. So for example, I actually have a page open right now. So if you're looking for example at here, they would say, oh, it's an observation visit and it has a detailed history and it has high exam and straightforward medical decision making. And you could look at this and go, oh, okay, well, it meets the detailed, it meets the detailed, it meets the straightforward. And this is the 99234 service, right? So what they're doing now is, I believe for these type of services, they do still give you the history exam, medical decision making, but for the new office outpatient codes, you have to score the note based off of the new 2021 criteria. And that is in your 2021 book. So you have to have a 2021 book if you're taking it in 2021 to have those guidelines available. It is 16, 17. Yeah. So this is the new criteria here, and it's broken down on 2 pages on 16 and 17. You can actually get some training for this on the AMA website for the new codes for 2021 that have changed, the 99202 through 99215. So you really want to teach quality eventually. I thought CDEO would be good. Yeah, that might be a decent one for that if you're looking to teach quality. Debbie, I just got a job in the radiology department as the schedule. I would take my CPC in August. How long before I look at the CIRCC? I would want to. So you're going to working in the radiology department as a schedule. I would pass your CPC exam first. Give yourself just a little bit of breathing room. Like honor where you're at for a minute. Just passed my exam. Happy, happy, happy. get familiar with your job because you don't want to be so focused on your new examination that you don't perform well at your job. So get the basics of your job down, make sure that you know what you're doing there before you try to dump more things on top of yourself, because you don't want to. I always remember my mom saying to my dad, he would always, he had a weight problem and he used to smoke a lot, and he would try to lose weight and smoke at the same time. And my mom would be like, no, just try and do one at a time, because if you do both, you're going to fail. And every time he tried to lose weight and smoke at the same time and quit smoking at the same time, he would always fail. So he would have, finally he did. Once he focused on like just quitting smoking, he was able to accomplish that same kind of process. You don't want to pile on too much, because if you pile on too much, you're going to wind up potentially failing at everything, right? So pass your CPC exam, focus on your job. And then once you feel comfortable with what you're doing at your job, not that you're necessarily the expert all thing, but that you're comfortable at what you're doing at your job, work into your CIRCC. I would also suggest, I have an agreement with radrx.com. If you go to radrx.com and order any of the trainings for the CIRCC and type in code Contempo10, she will give you a 10% discount for that. Jamie King, where can I find videos on the CPB? I ordered the study guide and the practice exams. I got my CPCA in December 2020. I've been looking for a job, but can't seem to find any other jobs. So I don't have any specific videos on the CPB. I think there are some out there. I would just check on YouTube, type in CPB or Certified Professional Biller, and see if anyone has information on becoming a CPB. I'm seeing a question here from Chusi, and it says, is the training free? I'm not quite sure exactly what training you're referring to. Maybe I missed something else higher up in the chat. So if you could just let me know what training you're talking about, I will definitely let you know. So Kashana is coming from the accounting industry. So besides the CPMA credential, is there any other credential I can take with an auditing role in the revenue cycle? So mostly the CPMA credential is the one that is for auditing. There is a lot of validation that goes into risk adjustment coding. It's not quite the same as auditing, though. I think there's a difference, between quality checks and validating and auditing. So in my mind, auditing, and I'm trying to do actually a little bit more focused auditing information coming up soon. But auditing is not just, oh, this is right, it's wrong. You met the criteria, you didn't meet the criteria. It's also formulating in Word why it didn't meet that criteria, the resources to feed back to why it didn't meet that criteria, communicating that in a succinct way that when a provider reads it, they can easily interpret it, they understand, and then providing even some feedback as far as, well, if you'd have done this, that would have met the criteria. And then even providing a summary of all that information, all the references, all the resources, potentially even corrective action plans. So I think CPMA is probably your best bet if you're looking into getting into more of that auditing role in medical coding. Oh, you should also check out NAMAS, NAMAS, the National Association for the National. Oh my gosh, I can't believe I'm blanking on it, which comes first. But it's the National Medical Auditing Society. I'll bring it up here because I am recently a member of NAMAS. I've been a certified professional medical auditor for a decade now. Just joined the Auditing Society a few months ago, actually. So that is a great resource if you're looking into getting into the auditing. So NAMAS, the National Alliance of Medical Auditing Specialists, that's what it is. And they have so many great webinars, just really professional, detailed, amazing information there. Janelle, I'll leave the coupon code in the chat here. So it's Contempo10. I think I have it linked in the video description. If not, I'm going to have to start adding it. Oh, and that's radrx.com. Stacy Buck is like, she's the go-to girl for learning interventional radiology and getting training for your CIRCC. Emily's asking, can you work at a hospital even if you have the CPC? So you could, one of the things to kind of point out the difference of, so I used to work for example, Penn State Health, and they were known for primarily Hershey Medical Center, right? So I technically worked for that health organization, but I didn't do hospital coding. I did professional coding audits and professional coding education. So you can work for the hospital but not do hospital coding. You might be billing for the physicians that work in that hospital, correct? So yeah, it is possible to work for a hospital but not do hospital coding, have your CPC. Now it's also possible to work for a hospital and do hospital coding. But if you're looking to get into hospital facility coding, then that's when you need your CIC or your CCS from AHIMA. So Mitt's asking, what's the difference between the CPC and the CRC, and which is better? Both are great credentials, amazing credentials. The CPC is the Certified Professional Coder, so coding for services that are for providers. So surgeons, internal medicine, OBGYNs, pediatricians, all kinds of different medical professionals. So billing for the surgeries, the visits, the potentially, studies or labs that they might have done. Like if you go in there and you get a glucose check or something, billing for that kind of services, the services that they provide, versus in your inpatient hospital stay where you're formally admitted to the hospital and you're paying for basically room and board of the hospital in kind of the way of thinking of it. The CRC is just diagnosis coding, so only using the ICD-10 CM code set. For the CPC, you are coding for not just ICD-10 CM, but CPT and HCPCS code as well. So 3 different books. The CRC, you only work with one, ICD-10 CM. So both are amazing. Honestly, I'm going to tell you, like, long-term goal, you should probably have both, because then you can do jobs in risk adjustment for the CRC and do professional coding. Sometimes in risk adjustment, though, they will accept a CPC. They aren't specifically looking for the CRC. I would start with your CPC, unless you really, really hate CPT and HCPCS coding. If you're like super in love with ICD-10 CM, you're like, I love ICD-10 CM, I just want to work with ICD-10 CM, then just go for your CRC. But you can always circle back eventually. There's no specific order you have to go in as far as getting your credentials. And also people ask, with AAPC versus AHIMA, you can go and get AAPC certifications and then go back and become a member of AHIMA as well. You're going to have 2 sets of CEUs, but that is something you can do. Adrian is asking, no medical background, going for your CPC. How long did it take you to feel comfortable with coding and terminology when you first started? Finding the terminology really overwhelming. Yeah, I had a rough time with terminology. The first couple semesters of terminology I took, I did really good, but then the third one, not as good. I think you get more familiar as you go. There's certain things that I look at now that I didn't know 2 or 3 years ago, maybe different medications that I'm now familiar with. And it does come a little bit more easy as you go along. Really the focus of it is getting those root words, those prefixes, those suffixes. And once you kind of understand those, you can put together just about anything. So really focus on those. I have flashcards, so those are helpful. So I have a video too where I recommend certain products like this and ways that you can learn MedTerm easier, or have resources that are free or cheap or just really, really good. So when it comes to MedTerm, I do have a video just for learning MedTerm. I think I might have these linked in the video description. I'm not sure, but these are my MedTerm flashcards. These are great. One of the best books that I have for learning MedTerm, there is a whole MedTerm book specifically for coding. So if that's the one you have, you're on the right track. If not, consider getting it. It is... So this is the 3rd edition, and it's MedTerm and Anatomy for Coding. Phenomenal book, phenomenal resources. Cannot recommend it enough. And there is a fourth edition available. So you can get the fourth edition. It's slightly newer. I think it has a little bit more infectious disease or something in it. And that is a fantastic resource for learning medical terminology. Quizlet, you can go on Quizlet. There's tons of free quizzes people have made to practice medical terminology and anatomy. And then there's JJ Medicine on YouTube. So you can go on YouTube and type JJ Medicine. They have a free med term course. Really, really great. I've also had some questions coming in about the COC. Do I have any information for the COC? Because I have that great COC video about what helped me during the exam. I don't currently have a COC review or training. It's on the list. It is on the list. I have a long list of stuff, to be honest with you. But right now, I have one particular program that I'm focusing on that I'm hoping to have available by 4th of July. So that is my focus right now. If you are interested in purchasing some of the coding and training that I have available, you can go to my website, contempocoding.com. So if you go to contempocoding.com, here's all of my courses that I have available. I currently have a full risk adjustment coding course, CPC review, CRC review, E&M training, ICD-10-CM, lesion training, and there is a free CEU course I have right now as well, modifiers for the medical office. I do have one more CEU course that I'm hoping to get together soon to offer for free. Do you think you can do the CRC after completing the CPC exam and getting good experience? Absolutely. I mean, you're still going to need training because the CRC is not just on ICD-10-CM coding. That's a huge chunk of it, but also learning the different payment methodologies, the quality payment programs for Medicare, and some of the Medicaid quality payment programs and information that they have. So it's not just enough to learn ICD-10-CM coding alone. You do have to go through at least like a study guide program or a review or a training of some sort. Is post-graduation qualification is needed to pursue medical coding? I'm not quite sure how it works in India. I don't have experience in that particular country. I apologize. Let's see. I know I missed a few that came in earlier, so I'm checking through the chat. By the way, while we're kind of going through some of the information, I also wanted to mention, don't forget that if you are interested in supporting the channel, I do have merchandise available, so t-shirts so that you can match just what I look like there in that cute little picture. So there is merchandise available. I also have, if you are interested in joining channel membership, I have channel membership that is available for a monthly subscription of $1.99 to $9.99 a month. And that just helps support me and the channel. All of our channel members get custom emojis, community only posts, and at the gold and platinum level, you get your name added to the end credits, and the platinum level, you get behind the scenes footage and outtakes. Let's see, what other comments have I got coming through here? How can I get a job in medical billing and coding? Do I need a degree? Actually, no. There are people who have gotten into medical billing and coding by self-study. And I do have a video on the channel on self-study options if that's something you're interested in. So if you go to contempocoding.com, there is a video on self-study options. It's actually in my Want to become a medical coder? Start here video. If you scroll just a little bit over, here's the self-study options. I think it looks fantastic if you go to maybe a business school or a career program and get something that's a little bit more than that. I think a 9-month program through those will look great to your potential employers when you're interviewing them. You know, it looks like you put in a lot more time, you have more dedication, you went through some formal training, but it is absolutely 110% possible to do it through self-study. There are independent instructors that you can train for medical billing and coding. So there's lots of different ones that are available out there. There's integrity coding, there's Ohana, there's CCO, there is lots of programs. I mean, I couldn't even list them all, but there's that as well. I also have an affiliation with onlinedegree.com. So if you're interested in getting a online degree that you can take it completely online and get some different features, you can check out the link that I have to go to onlinedegree.com/contempo. And that is specifically for my viewers. And they do have some specials that are available just to the viewers of my channel. Is it common for people to do medical coding and billing or just pursue one of them? I think if you're going through a accredited program through a school or a university or even a just technical school where they're maybe even doing a shortened abridged crash course program, most of them are designed as a billing and coding program. It's typically kind of bundled together because they do go hand in hand. But then what happens is oftentimes, you make the decision, do I want to get into just billing? Do I want to get into just coding? I think a lot of times in private practices or smaller groups, the biller and coder are the same person. So they often do lump that together because of that purpose. In larger organizations, there's usually a billing team and then a coding team. Sometimes they do cross over job tasks a little bit, but it depends on which you like. So try both, see how you feel. If you get into billing and you love it, then that's great. If you just want to get into coding because you don't want to deal with the insurance companies, then focus on coding. But also understand that sometimes in order to get into coding, you might have to get some jobs that aren't, your title won't be medical coder. It might be prior authorization specialist, or it might be schedule, or it might be accounts receivable working in billing until you can get into a coding position. Yeah, Brenda says 9 months is not enough long time to learn medical coding. Believe it or not, there are a lot of programs out there that will have boot camps where they teach medical coding in 3 days. And then on the 4th day, you test for the exam. I think those are probably really great for someone who maybe is already in healthcare, like you already know med term, you already kind of know about that stuff. But if you're someone that's new, it can be a while. I think the AAPC programs are usually 3 months, but that's again not including medical terminology. That's not including anatomy. That's not including learning insurance, other than the basics like what's a commercial versus Medicare versus Medicaid. Can I work remote as a medical biller and coder? Absolutely. So, believe it or not, medical billing and coding has been, especially medical coding, has been one of the top remote work positions for a number of years. And I think there's been a lot of focus on it now after the pandemic because so many people are looking for remote work. And that's one of the things that's been popping up on the tops of the searches, is because that position has been remote for a long period of time. So yeah, you absolutely can work completely remotely as a medical biller and coder. I used to say that it was harder to find remote work when you're fresh out of school. Um, I think I think that has definitely eased with the pandemic. There used to be a lot of organizations that would say, no, like our coders need to be on site. There's no way we could possibly train people or do orientation remotely. And when the pandemic happened and they were forced into a position where now we have to figure out how we're doing it, they relaxed a little bit. And now there are more organizations that realize, oh, well, we can train remotely. We can figure out a way to make this happen. So there are um, more remote positions, I think, that have happened. There are still a lot that want coders on site. Check in your area, check some of your listings, go on like indeed.com and see what's available in your area. If they want coders to be completely on site, or if they allow them to work remote, what the salaries are, you can kind of get a feel from there. So, um, yeah, and if you're liking this content, don't forget to like, share, and subscribe. So Tada is asking, is your free webinar regarding risk adjustment still available? So I took it down right now because the webinar has been up for probably 3 years, and I didn't want to continue just renewing CEUs for something that has been available for 3 years or I made 3 years ago. So I will be creating some new free webinars. But right now it was taken down off of the website. I do have other information about risk adjustment on the channel. So the CRC information, and then just thank you, Wang, for subscribing to the channel, and some additional information about just HCCs. So I have a video that's just about HCCs if you're looking for that information. I just can't offer CEUs for it right now, but I am creating some additional free CEU webinars coming on up. The first and most important certification to do in medical coding is, in fact, the CPC. Patrice is taking her CPC right now, or his, not sure. I apologize if I did not get your pronouns correct. I am taking the CPC course through the AAPC, and it's intense. It is intense. I was wondering if you had any tips for studying and the course, maybe not read every single word in the book. It is intense. As far as not reading every single word in the book, gosh, the tough thing is it is a book and you do kind of have to read it. What would be my tips on things to focus on? So I do have some videos that I've been doing on reviews for each particular chapter, starting with integumentary and working onward, and then I'm going to end with E&M. I would check some of those out. Your textbook. What I would focus on is reading through your textbook, because I think they sent you probably either a paper or an ebook maybe, and do those practice cases on them, because those practice cases that they put in the textbooks and in the study material, those are really, really going to be a good indication is if you're retaining it or not. And then looking at the rationale of those and going, oh, I didn't get this correct. Well, why not? And what didn't I pick up that I should have? So those are invaluable, just going through some of those practice questions and then reading the rationale and then guiding yourself and correcting yourself as you go on, like where did I miss something? And the guidelines are really important. So if you're going to read anything, especially with ICD-10-CM, read through those guidelines. Those are super, super important. Stephanie is asking, does scribing count as relevant experience before getting a coding job? Absolutely. Absolutely it does. Because first and foremost, not only are you familiar with working with providers, you're familiar with working in electronic medical record systems. You're familiar with how they might place their orders, how they format their documentation. Those are absolutely crucial and very important things to highlight when you're looking into coding. And especially because, and sometimes you even see the orders that they're placing maybe for their charges. You can see when the provider maybe is doing a 99213 versus a 99214, and what their documentation looks like for the 3s versus the 4s, and how they sign things. And just understanding that workflow is just so incredibly important. I can't tell you how much stuff I learned from going and shadowing providers that I was like, oh, well, that's why when I see this on the back end, it looks like this. Hey, Faraz, good to see you here. So yeah, that's an excellent way. Scribing, I think, is great. For a while, I know the AAPC was saying that they were going to have a scribe certification, and I think it just kept going on the back burner and going on the back burner. So I don't know if that card is still in play yet or not. But I think scribing, definitely make sure that you're highlighting that as well. If you are making a transition from scribing to coding and need help with how to put that on your resume, check out Project Resume. I think it's projectresume.net. Let me just double check. Oop, I typed in .com even though I said .net. And so if you go to projectresume.net, they can help you craft a resume that will help for not just beginner coders, but coders transitioning in healthcare, coders that maybe want to highlight a certain specialty or their different expertise that they might have. Tell them that you got a referral from Victoria from Contempo Coding, though, if you go to projectresume.net, because they have really good, they're just like phenomenal. Everyone just raves about the resumes that they get from Project Resume. Sharon is asking, what does CEU mean? So a CEU is a continuing education unit. So coders, just like physicians and just like nurses, have to complete a certain amount of continuing education units every single year or other year. So for the AAPC, if you have one certification, you'll have 36 CEUs due every other year. And you can get CEUs from things like Healthcare Business Monthly Magazine that the AAPC sends you. You can get them from webinars. You can get them from training. You can get them from going to chapter meetings. There's a lot of great free ways to get those continuing education units. And if you think of it like a webinar, if you do like a 1 hour webinar, that's usually one CEU. Typically, they attribute to like a 1-to-1 match with hours. So if you do a 4-hour webinar, it'll probably be about 4 CEUs. But you have to check to see if it is approved for those CEUs, because you might do a 4-hour webinar and they might not have any CEUs approved. There should be like a little logo or indication somewhere saying, hey, this is approved by the AAPC for 4 CEUs. And you have to make sure that it's for your organization, because there's CEUs for the AAPC, there's CEUs for AHIMA. They don't always necessarily cross over. So make sure that it's for your right organization. But if you want to know more about CEUs, I think I do have a video on how to get free CEUs. And there is some information on the AAPC website about the requirements for CEUs. And actually, as you get more certifications, then you have more CEUs that are due. And if you don't complete your CEUs and don't get them in time for your membership renewal, you are at risk of then losing your certifications that you have. They will sometimes allow for an extension, that if you call and say, oh my gosh, I didn't realize my CEUs were due, they will occasionally allow for an extension. But if not, then you lose your certifications. And you definitely don't want to do that, because 5 hours and 40 minutes of an exam is way too much to have to test for again. So let's see if they have some information about CEUs. Yeah, so there's even a section on the website where you can browse for different CEUs if you're looking for a certain specialty. And if you just are looking for general information about CEUs, it talks about what they are, what are the minimum amount, how often they're due, and then how sometimes if you have certain specialties, that continuing education program that you attend for CEUs has to be designated that they have CEUs specific for that specialty. Donna says, I am struggling with E&M. You're not alone. You're absolutely 110% not alone. I think I actually did an E&M series where I started with it. I started it out with, do you think E&M coding kind of sucks? And if so, you're not alone. Yeah, E&M's a toughie. There are some free resources I can guide you to. So on my website, I do have a whole playlist just for evaluation and management coding. Now, this was made prior to the 2021 guidelines. So I have some additional resources for that. So this whole series here is part 1, part 2, part 3. So this is based off of the ones that are history, exam, medical decision-making driven. So this one is history, exam, medical decision-making, putting it all together. I have some case studies for E&M. Those are absolutely free and available for you and everyone else. How to make score sheets. And then this is just going over those 2021 guideline revisions. I'm still working on, because it's going to be so much, but I'm working on a video that I'm going to do, and I'm just going to call it I Coded E&M Services for an hour. And it's just going to be an hour of me coding different E&M services. I also have training available that you can attend if you're interested in supporting me in the channel by attending my E&M training. I have E&M training available for $49 on my website, and that does provide CEUs as well. There is a great preview available too. So if you want to ever see what my courses look like, this has a cute little preview on it that it'll show you, and I'll turn the volume, make sure the volume's down, that it shows you like what the course kind of looks like. And you can see what the flow of it is. And so if this is something that you'd be interested, that you think that this is something that you will benefit from, like it's your kind of learning style. Why do I think E&M is a toughie? Oh my gosh, it is. It's like reading, oh my gosh, like stereo instructions made by Medicare. You know, it was once described to me a number of years ago that the reason we can't just code based off of time alone is that there's a lot more that goes into it just based than just time. Like someone who's been in the industry for 20 years, they can look at a patient, they can diagnose them in no time. And it's not fair that they would get to bill lower because they see patients in that lower amount of time versus someone who, you know, comes to the same conclusion, does the same workup, but it takes them longer. So it's just a lot of factors to figure out into how to level of service. And some of it is just a little bit still objective. Even though we've changed some of the guidelines, there was a webinar that the AMA, the American Medical Association, did like last month, where they were very shocked at some of the questions they were still going, because they're like, hey, we changed this and we thought we made it easier and we thought we made it more intuitive. But there were still a lot of questions people had about it. It's just so much is up to interpretation, I guess. With the new changes this year, they went to either or. Yeah, so the 2021 is now either medical decision making or time, and the time is total time. So some of the things that used to not count for time now do count for time. So things like typing into your EMR and dictating, and basically everything except for rooming the patient or anything else that you're billing separately for. So I just enrolled in CPC in the Middle East and wondering if I can get a job in America or Europe, possibly. It really depends, though, on the individual employer. So what that particular employer's policy is on if they do allow international employees. Why couldn't I think of that? International employees for their particular organization. Yeah, and I know another question did come up about what is the eligibility. Again, that depends on the particular employer. It's not like there's an industry, there isn't an industry standard to say like, oh, in medical coding, this is the criteria we use or we don't use. It really is individual employer and project dependent. It doesn't kind of go by, you can, you can't, in every certain, it really, really, really is employer dependent. That's okay, Janelle. I don't mind about the all caps. It's okay. So Clarity saying, I'm considering getting either a Codify code search, most basic version, or the 2021 or 2022 Profi ebook bundle to help with Practicode. Opinions on what might be better. So if I remember correctly, I don't believe the basic version gives you the lay descriptions. And if you're working on Codify, I think what would really, really help you out is having those lay descriptions to the different procedure codes. At least that's what helped me out, like seeing it in lay description. So I can show you what I mean, because I do have a Codify subscription. And I think the basic version doesn't go those, but if you get one of the books, they will have it in you. And those aren't going to change too much from 2021 to 2022, the lay descriptions of the different procedures, unless there's maybe a new procedure that comes between now and then, which we do have new procedures that are going to get added. But are they going to be in a rush to add those on to the Codify program? Probably not. So let me just log into my Codify real quick. Okay, so if the basic version has lay descriptions, I think that would be good. Does it have CCI edits? Because that's another thing that'll come up in working with Practicode. Stupid number lock. Hold on one second. 1-4. So if I go into Codify, it'll give me, and I have thank you, Donna, for subscribing. I have a more robust version of Codify where it'll give me the lay terms, which is it's just so phenomenally helpful. And I can also do CCI edits. That's another important thing you'll want for Codify, but you can actually get those for free on the CMS website. So I would say if the basic version has lay version, I would get with that. But your CCI edits you can get for free. The books, I don't believe, have the CCI edits in them. But the bigger versions, I like that because I can type in my codes and get my CCI edits right away. 11402 and CCI check. And it'll tell me that there's a CCI conflict here and that I need to add a modifier if I am meeting the circumstances in which I can unbundle those. I personally love my Codify. I think it's a great program. I absolutely love it. I would say get the basic version of Codify and then make sure that you're familiar with how to look up the CCI edits. on the CMS website and use their tables there. I've been doing medical billing for the past year, but I am seriously considering getting my CPC and possibly the CPB. I hear people saying that the CPB is a waste of time. Feedback, please. That's a great question. So, if you're already in billing, you probably won't need your CPB, right? I think it shows that you have proficiency. I think it looks good for transitioning if you're looking for a different billing or coding role. As far as it being a waste of time, I don't think so. I mean, it's a tough exam, first off. Also, I think there's more employers looking for it. So, for example, if I go into Indeed.com and I type in CPB, there are employers that are looking here for their CPB, and some of them are medical biller. What's medical from remote work from home? Where does it say CPB here? Now I've got my curiosity piqued. CPB. Yeah, preferred qualifications, revenue cycle certifications. The following are recognized professional certifications. The CPAR, the CRCR. That one's really like a lot of people I know are getting the CRCR, Certified Revenue Cycle Representative. That's a great credential. And the CPB. So there are positions out there where they're saying they would really like someone who has their CPB. So I absolutely don't think it's a waste of time. I think there definitely are employers out there that are looking for the CPB credential now. Is it absolutely 110% necessary to work in billing? If you're already in billing, I mean, probably not. But if you're someone who maybe is looking to transition or you are looking to get into billing, I think the CPB is a great credential. I think it's getting a lot more esteem than when it started. A lot more esteem, definitely, for sure. Hey guys, guess what? We're up on our hour. Do you believe it? Absolutely. Wow. So can you get a job after the CPB? CPC? Yes, you absolutely can get a job after you get your CPC. Guaranteed a job? No. You're going to have probably the same job search struggle that a lot of people have when they finish any other training program. Finding a job these days can be tough, especially with entry-level stuff. So I just want to say, thank you guys so much for coming and spending another hour with me on a wonderful Saturday. I will see you guys here again next Saturday at 2 p.m. But until then, keep on coding on.